Hey guys, my name is Boris. I'm a physician assistant, and the topic of this video is going to be PA versus MD. Why did I choose to become a physician assistant rather than a medical doctor or a doctor of osteopathic medicine, an MD or a DO? Why did I choose PA? Okay, so the first thing you'll notice is that I have physician assistant right on my shirt. I'm obviously proud to be a PA. This wasn't a backup plan. It's not like I really wanted to be a doctor and I couldn't get into med school and I, chose to be a PA as a backup. That's not what happened. I, like many PAs and NPs, chose this career path for a very specific reason why we actually wanted to be PAs and not doctors. They're very different jobs. In the day-to-day, yes, you're taking care of patients, you're making diagnoses, you're prescribing medications, you're treating, you're giving medical advice, you're doing procedures. A lot of the day-to-day seems very similar, but PA and MD are actually very different jobs. Sorry, I got distracted. There was a cute dog walking by. Anyway, and nothing in this video is professional advice for you. I don't know you, so I don't know what's important to you, but I can just tell you exactly for me why I chose PA over MD. So the first thing that you should consider when you're thinking about what career path to choose is who are you as a person? What is important to you as a person? Who are you? What do you like to do? What do you not like to do? What is very important to you in the day-to-day and also in the long term over the course of your life? What things do you know about yourself that make you happy and satisfied? And what things do you know that you just can't stand, especially for a long time? So for me personally, this video is about me and why I chose PA. For me personally, I know that the most important thing to me in the world is growth, personal growth, growing as a person, learning more and more things, constantly learning, evolving, becoming better at doing things, becoming better and more knowledgeable about the way the world works, about the way people work, about just in general. I love growth. I have to constantly be learning something new. And for those of us that are like me, that enjoy growth, personal growth, professional, financial, skills, everything that we want to do, we know that it's kind of a gift and a curse. The gift is we want to learn very quickly and we're very eager to get to know things, to get better at doing things, to practice. But also we know that it's a curse because once we get good at something and it becomes routine, we get bored and we want to do something else. So we're never truly just an expert at anything because once we're pretty good at something, once we're satisfactory good at something, we move on and we do something else. So I know that about myself. And as you can imagine, that makes the PA profession perfect because you're constantly learning something new. And you have the ability to constantly shift gears. Once you feel bored about something, you can do something completely different in the field of medicine. For example, the example I always give, if you start working in primary care, and there's obviously a lot to learn in primary care, you see almost every kind of condition, but once you get comfortable with your role and your role in the healthcare system, because you're not doing everything, you're doing very basic management of certain conditions and you're doing pretty advanced management of the chronic conditions, so hypertension, diabetes, hyperlipidemia, things like that. But once you get comfortable with those things, your job becomes pretty routine. Yes, you do see the rare condition every once in a while, but mostly it's the same thing over and over and over again. So in primary care, for me personally, I got pretty bored. Within like a year, maybe close to a year and a half of doing primary care, I just started to see it as routine. I found that I just wasn't growing very much as a provider. And I started to get itchy feet, just like Chris McCandless from Into the Wild said, and he knew that he had to move on every time he got to a new town and he figured out how that town worked. He just knew that he had to move on and he had to learn more things, see more things, experience life more. So I feel the same way. As soon as I figured out that my life was becoming routine, I was treating the same kinds of things almost every day, I realized I wanted to keep learning, especially as a brand new provider, okay? Primary care is my first job, so I knew that I wanted to learn more and more while I'm a brand new provider. So an opportunity presented itself to consider getting into urgent care, and they had this fellowship that was going to train you how to do things, how to take care of things that I never knew how to do. And so I was very interested and excited to grow more as a provider and as a person. So that's the direction that I took personally. And of course, I don't see myself doing the current job that I'm in forever. If that ever becomes routine, if that ever becomes boring, if I just don't feel like I want to do it anymore for whatever reason, as a PA, I can switch gears completely and do something completely different. Let's say I decide that dermatology is very interesting to me. I want to learn more about the rashes that I see and learn how to treat them in a more advanced way. I can go work in dermatology. If I decide that I just really love working with my hands and I like making these intricate suturing procedures, but I want to do more and more and take care of more interesting things, I could go work in plastic surgery and I could do things like that. If if I just get very passionate about gastroenterology and how the GI tract works and treating GI conditions in a more advanced way that I can do in primary care or urgent care, I can go do that. I can go get a job in gastroenterology and spend, months, years, however long it may be, to feel like I know how to manage at least most basic GI conditions. And that'll probably satisfy my appetite, my hunger, and my interest in knowledge in that field. And then I would probably move on to something else. Let's say cardiology. I see a lot of people suffering with cardiac conditions that are chronic and not well managed. Maybe I would work in cardiology, learn how to manage cardiovascular conditions in a more advanced way than I've ever been able to in primary care and urgent. The point is, at least in my opinion, is the PA profession is perfect for people who love to keep learning. They do want to get good at things. They do want to be able to contribute and serve their community and help people. But once they feel like they've kind of got it, they got the gist, they have a basic idea, they feel like they've handled at least most common situations in a certain field, they feel like they want to move on and learn something else, which is the beautiful thing about a PA. Because after 5, 10, 20 years of a career of doing that, jumping around from field to field to field, maybe working in 2, 3, 5 different fields over a 20-year career, you've got this broad knowledge of medicine that nobody can compare to. Nobody. Maybe an internal doctor with a lot of different experience in various fields, maybe. But otherwise, a 20-year PA who's really taken seriously a multitude of different fields and has experience in, let's say, cardiology, let's say plastic surgery, let's say they've done primary care, urgent care, emergency medicine, they've done all those things over 20 years, nobody can compete with that knowledge that is invaluable to serving your patients in your community and also to yourself. Like, you feel like you really was able to satisfy your appetite for knowledge in all these different fields, okay? So for me personally, someone who really likes to learn and grow and always try new things, PA is the perfect career over MD. Because what an MD does is, one, the training is much longer, and you do get a very good idea of medicine, much more so than in the PA training, but then you specialize. You do a residency that's another 3, 5, 7 years, getting really into the nitty-gritty and really learning one field of medicine very, very thoroughly. So you're the subject matter expert in that one very narrow domain of medicine, which is sweet for some people who really want to be the expert, the top dog, and know absolutely everything there is to know, or almost everything there is to know about a certain field of medicine. But for me, that's just not my personality. I'd rather see 80, 90% of people and be able to help 80, 90% of people in most of those fields. And then if there's something that I just don't know, something that really needs expert attention, expert management, then refer to the specialist and send in that direction. But I would like to know at least how to help most people in most situations. So that's my personality. That's why I love PA. I love being able to do a little bit of everything and learn a little bit of everything and just feel like I've got this broad base of knowledge. And when I get bored with something, to be able to shift gears and get out of that situation and go do and learn something else and get good at that. And then when I feel like I've got that, something else seems interesting to me, move in that direction, explore that, get a job in that for a year, for 2 years, for 5 years. Who knows, maybe at some point I will have totally different life circumstances, maybe a family, maybe something that's keeping me grounded and keeping my attention and my appetite for change and chaos and learning new things. Maybe something will keep my attention that way and I'll stay in one certain field of medicine for a long time, because that's going to be my little stable rock that I have to depend on, things that I can know and be good at and is my routine when something else is chaotic and interesting to me. But for now that I'm like young, not tied down for any reason, I'm still exploring my options in my career. I'm brand new provider, less than 2 years experience at this point, getting close to 2 years. I just want to keep shifting around and keep learning more things and learning as much as I can, because that's exciting to me. So that's why I chose PA over MD and DO, is because of that lateral mobility. That's the buzzword for your CASPA essay, right? Lateral mobility, being able to move and have the same position as a physician assistant in all these different fields of medicine. That's my primary reason for choosing the career path. And just one other thing about that, if that's not it for you, if that isn't really attractive to you, it doesn't mean you shouldn't be a PA. It doesn't mean that at all. It just means that for me, that was the primary reason. For you, it might be that you just love medicine. You want to practice medicine, but maybe you don't want to spend the 10 years it's going to take to become a doctor. Maybe you want to spend 2 years in school instead of 10, because you want other things. You want a family, you want a meaningful relationship. You want to be able to spend time doing other things, passion projects, hobbies, like me also. Maybe that's why you want to be a PA. You still want to practice medicine, but you don't want to commit your entire life to it and all of your 20s and 30s to it before you can even start working and have a life. That's a pretty good reason. I'd agree with that reason too. It just wasn't my primary reason for becoming a PA. My primary reason was being able to change gears and do something different anytime I got bored and decided that I want to explore something different. But for you, it could be something totally different. This is just my 2 cents why I chose PA over MD. I'll see you guys in the next video.